Hi friends, let's talk about abnormal uterine bleeding, which was initially called as dysfunctional uterine bleeding. Now what is this abnormal uterine bleeding? This can happen to anybody from the age of 12 to 13 years to the age of 50 years. Before I talk about abnormal uterine bleeding, two things that should not be done for abnormal uterine bleeding is DNC and then hysterectomy. Now DNC is a procedure which was done before, wherein they used to blindly curate the uterus and then send the material for histopathology. Now what is the disadvantage of this DNC? This is basically because it's a blind procedure. The moment when the uterus is abnormally curated, the bleeding increases, and if there is a polyp, it will start bleeding more because the polyp is half removed. So a DNC should not be done. It is now completely obsolete. So do not get a DNC done. Second is hysterectomy. All dysfunctional uterine bleedings or all abnormal uterine bleeding should not end up with a hysterectomy, because hysterectomy has to be done only in cases of cancer above the age of 48 or 49 years or 50 years, or if there are large fibroids, that is also after 48, 49 years or 50 years, or if there is abnormal uterine bleeding after 50 years or postmenopausal bleeding where there is suspicion of uterine corpus cancer, that is cancer of the endometrium. So now how do we treat this DUB or AUB? AUB can be treated either medically or surgically. Today in this video, let's talk about the medical management of DUB. There is a classification which all medical students learn. Let me just simplify you and tell, that is abnormal uterine bleeding when there is a problem, that is which can be surgically corrected, that is polyp or adenomyosis, myoma, malignancy, that requires surgical intervention. But if the abnormal uterine bleeding is hormonal, then this can be treated just by medical management, and if necessary a hysteroscopy. I said DNC should not be done, but we can always do a hysteroscopy and see what is inside the uterine cavity. Suppose there is a bout of bleeding, abnormal bleeding, which you've been having regular cycles, but once all of a sudden you have an abnormal bout of bleeding, go to your doctor, get advice. There could be a thick endometrium, it could be an anovulatory cycle. So just a medical treatment is going to take care of your abnormal uterine bleeding. But what happens, sometimes it may not go with one episode. There could be multiple episodes of bleeding, and the treatment can extend from 3 to 6 months. Please take medical therapy, because there are so many newer progesterones which are now invented and is given for abnormal uterine bleeding, and when we treat them for abnormal uterine bleeding, patients respond to it and they become normal. But if we try to remove the uterus or try to do a DNC, patient can have more problems than good. So whenever there is an abnormal uterine bleeding, always opt for medical therapy, take a second opinion if necessary, and then get yourself treated for that. But if the abnormal uterine bleeding is associated with a polyp or a fibroid or adenomyosis, surgical intervention may be necessary, but not removal of the uterus. But in case the abnormal uterine bleeding you have is just responding to your medical therapy, continue your medical therapy. You know that you can't take a medical therapy for more than 3 or 4 months. So in such cases, there is something called Mirena insertion, which is also called as levonorgestrel IUCD, which we insert for women. And once you insert that, for the next 5 years, this lady is away from abnormal uterine bleeding. So dear friends, whenever you have a problem of bleeding or abnormal uterine bleeding, please consult your doctor. Don't go for DNC and always stay away from hysterectomy. Thank you.